This presentation on Lyme disease was done by Rachel Trego, Olivia Fulton, Avery Bunch, and Brian Pham.
Causative agents. Lyme disease is caused by Borrelia burgdorferi, a gram-negative microaerophilic spirochete. The Borrelia chromosome is unusual in that it is linear and present in multiple copies. B. burgdorferi also contains many plasmids that contain genes usually found on bacterial chromosomes.
How is Lyme disease acquired? So Lyme disease is transmitted through a bacterium known as Borrelia burgdorferi, and it is spread through an infected tick bite. Right now, there is no evidence that Lyme disease is transmitted via person to person, but it is mainly known to be transmitted through tick bites. The tick must be attached to an individual for about 36 to 48 hours or more for this disease to be transmitted to the person. Ticks can be also attached to any part of your body. This includes the groin, armpits, and scalp, which are hard to see areas on your body. So you have to be careful. Environmental factors include grassy and heavily wooded areas. These tend to increase your risk of getting Lyme disease just because it's really tick infested. There are a lot of ticks, and it just raises your chance of being bit by one of these ticks. Places like forests and hiking trails also increase your risk, and we put protective clothing on here because it's just really important to protect yourself with clothing when saying going for a hike or going to the park. Also at the bottom of this slide, we see the comparison of a dime to the ticks in size. You see an adult female, adult male, nymph, and larva. These are all ticks that can transmit this disease.
No.
Lyme disease characteristics. When an infected tick bites the skin, the spirochetes are then introduced. They multiply and migrate outward in a circular fashion. There is an inflammatory reaction in the skin due to the lipopolysaccharide layer of these gram-negative bacteria, and the resulting rash expands. The saliva of the infected tick suppresses the host's immune response at first, which allows for continued multiplication of the spirochetes at the site. The dissemination of the bacterial cells enter the bloodstream.
I'm in the middle of this presentation thing.
After the first few weeks, it becomes difficult to recover B. burgdorferi from blood or body tissues.
Signs and symptoms. Lyme disease can be classified into 3 stages of progression. The first stage is called early localized Lyme disease. This occurs hours to weeks after the tick bite. The bacteria has not yet spread throughout the body at this point and is the easiest to cure at this stage. Some common symptoms and signs include the erythema migrans, which is the commonly known bullseye rash, which you can see in the pictures to the right, flu-like symptoms, including fever, chills, fatigue, and other symptoms. Headache and neck stiffness are also very common. The second stage is called early disseminated Lyme disease. This stage may occur weeks or even months after the tick bite. The bacteria have begun to spread throughout the body and are beginning to cause more systemic problems. If the individual did get the characteristic rash, it can migrate during this stage and cause multiple bullseye rashes. This stage is often characterized by an increase in symptoms and a lowering in the quality of life. Some common symptoms and signs of this stage include the continued flu-like symptoms, headaches, which are extremely common, pain, weakness, or even numbness in the arms and legs, heart problems, including palpitations or chest pain, and even facial paralysis. The last stage is called late disseminated or chronic Lyme disease. This stage occurs if the disease is not treated quickly or properly in the first 2 stages. This stage occurs weeks or even years after the tick bite. The Lyme bacteria at this point have spread all throughout the body, and many patients experience a multitude of symptoms, including neurological or even cardiac, because if you consider this, the bacteria has spread to their brain and heart at this point. Some common symptoms and signs include chronic arthritis in the joints, with migrating pain that comes and goes from the joints and tendons, severe headaches or migraines, mental fogginess, concentration issues, problems processing information, which is sometimes referred to as brain fog, severe fatigue with disturbances in sleep and insomnia, neurological and psychiatric symptoms, including depression, anxiety, OCD, and even sometimes dementia-like symptoms. There are many more possible symptoms, and what makes things even more difficult is that everyone may experience different types, and this makes it even more difficult to determine that it is Lyme disease. I've added this infographic in here just to show some of the many symptoms that those with Lyme disease may face. As you can see, it's a pretty extensive list, and the symptoms range from head to toe. No wonder it takes years to get diagnosed, because everyone responds differently to this infection.
Diagnosing Lyme disease. So, how is Lyme disease diagnosed? Well, it's a two-step process, and it first starts with the enzyme-linked immunosorbent assay test, which is known as the ELISA test. This test detects antibodies to the main bacterium that causes Lyme disease, known as B. burgdorferi. The second part of this two-step process is the Western blot test. Now, this detects antibodies to several proteins of the main bacterium that causes Lyme disease, and is usually used to confirm diagnosis from the ELISA test, so it improves confidence of the diagnosis. Well, this being said, this two-step process is not 100% accurate and can easily cause misdiagnoses. This is sometimes due to people being tested positive because they were infected with Lyme disease previously in their life, but this disease is not currently active in their life and not causing illness. In some cases, a person may even test negative when they actually have been infected. Moving on, how is Lyme disease distinguished from other diseases? This is a very, very difficult question because it is difficult to diagnose and distinguish this disease from other diseases. Healthcare professionals will usually look for a Lyme disease characteristic rash. There's actually a picture of a typical rash from Lyme disease on this slide. And if no rash is present and they have other symptoms of Lyme disease, they will ask for a medical history, any activity outdoors, and perform a physical on the patient. Like I said, diagnosis of Lyme disease is very tricky, and it's mainly because symptoms can closely resemble other illnesses and diseases. This disease is also known as the intimidator disease because it always looks like it could be other chronic diseases because of the similarities in symptoms. Ticks that transmit Lyme disease can also spread other diseases as well, which make it even trickier. With all this being said, the common telltale signs of Lyme disease include rash, headaches, joint pain, and neck stiffness.
The severity of Lyme disease worsens as the condition goes untreated. Once it goes untreated, it eventually turns chronic. It then becomes a lifetime of symptoms, and the quality of life of those infected dramatically shifts. As the disease progresses, a continuous cycle of severe fatigue, stiff neck, or even facial paralysis can occur. Those infected with chronic Lyme disease will have treatments almost every day. And the severity of Lyme disease comes from the quality of life taken away from those infected. They face severe fatigue, most times can't even get out of bed, muscle aches and pain. This creates a risk for depression and other mental health issues because of the quality of life. If you look to the graph, it shows how chronic Lyme disease patients suffer from a worse quality of life compared to those with other chronic diseases.
Treating Lyme disease. The type of treatment an individual receives often depends on the severity of their symptoms and the stage they're at in the progression of the disease. If you are lucky enough to catch the infection in the acute stage, you can treat the disease more easily and often in less time. It can usually be cured with a short course of oral antibiotics. Those with chronic Lyme disease can take weeks and even up to years of treatment. At this point, with the infection spread throughout the body, it is not guaranteed that you can completely get rid of the bacteria. The goal is mainly to get to a remission of symptoms. Lyme disease is generally treated using a combination of antibiotics, whether oral or intravenous, herbal protocols, supplements, and various other medications and procedures. The treatment of Lyme disease is focused on using a combination of medications, usually antibiotics, to treat the different forms of the bacteria. The Borrelia bacteria exists in 3 major forms, which are targeted by different antibiotics. The cell wall forms are the spirochetes that are in the classical corkscrew shape. The cystic forms are the cyst, which is created in hostile environments. This form actually protects the bacteria from being killed by the immune system, and it allows it to lay dormant. Finally, the bacteria also forms biofilm colonies. These are aggregates of bacteria, both the cell wall and the cystic form, that have adhered to each other and are embedded in a slimy substance made of extracellular material. This biofilm allows the bacteria to communicate between themselves, exchange DNA, and even allow them to be resistant to some antibiotics. The biofilms are a main part of the reason why Lyme disease can be so difficult to treat. Types of antibiotic treatment. The 3 first-line oral antibiotics that are most commonly used are doxycycline, which is a bacteriostatic antibiotic which has the advantage of twice-daily dosage, amoxicillin, which is a broad-spectrum bactericidal antibiotic which works by inhibiting cell wall synthesis, and cefuroxime. Cefuroxime is a bactericidal cephalosporin. It works by disrupting cell wall synthesis. Intravenous antibiotics are often used in individuals with neurological Lyme disease, cardiac Lyme disease, or Lyme arthritis that has not yet responded to oral antibiotics. Ceftriaxone is the most common IV antibiotic used. It is also a cephalosporin. It has excellent penetration of the blood-brain barrier and is an effective drug for Lyme disease. Most patients going through IV antibiotic treatment get a peripherally inserted central catheter to administer these infusions.
Some interesting facts about Lyme disease are, in order for the tick to infect you, it has to be attached to the skin for at least 36 hours. Ticks secrete a numbing agent when they bite you, so you might not even know there's a tick on you. 25% of cases of Lyme disease is reported from children. Less than 50% of people infected get the bullseye rash. Most health insurance companies do not cover the cost of chronic Lyme disease, and some medical professionals call Lyme disease the great intimidator because the symptoms look so much like other chronic diseases, which delays being diagnosed with Lyme disease. Lyme disease has been found in every continent but Antarctica, and Justin Bieber currently has chronic Lyme disease and has spoken out about it.
I would like to help you better understand this disease by sharing my experience with Lyme. I first began experiencing symptoms back in 2017. It really just started off with some abdominal pain and headaches that continued to increase in frequency and severity. I ended up deciding to go see a neurologist who told me that it was all in my head and I was just having senior year stress. He put me on Prozac, and that did not sit well with me because I knew this was not all in my head, and so I sought out other doctors. From here, it took 1.5 years to get the proper diagnosis of Lyme disease. I saw so many doctors, including ophthalmologists, neurologists, cardiologists, gastroenterologists, headache specialists, several internal medicine doctors, and I even went up to North Carolina to see the Duke radiologist team. It was an internal medicine doctor that eventually diagnosed me with Lyme disease after I started experiencing joint pain in May of 2019, 2 years after I first began my symptoms. I'm still currently treating for Lyme disease with IV antibiotics via PICC line that I had inserted in July of 2019. It has been an incredibly long and difficult journey, and I still have a ways to go. My experience with diagnosing Lyme disease. It took 1.5 years for me to get a diagnosis, and it was not an easy process. I had countless doctor's appointments, 2 ER visits, several MRIs of my brain and spine, CT scans, an epidural blood patch for an assumed spinal fluid leak, 3 lumbar punctures, an upper endoscopy, a lithotripsy, a nuclear medicine test of my gallbladder, tons of x-rays, and so many blood draws. This is just a short list of what I had to go through before I even got diagnosed. After I was diagnosed, I have been treating with antibiotics since May of 2019. I have taken oral doxycycline, oral rifampin, oral plaquenil, IV Recephin, IV doxycycline, IV rifampin, and IV azithromycin is the medication that I'm currently taking. Besides this, I've also done hyperbaric oxygen treatment. I had the PICC line placement to get the IV infusions. I do weekly IV saline infusions. I've had 6 ER visits since getting diagnosed. Yes, 6 visits. And I follow herbal protocols, and I'm taking a new experimental medication called Antabuse, which they actually give to alcoholics, but in recent clinical trials, they have found out that it treats Lyme disease. I also wanted to add a list of symptoms that I experience so you might understand what I've been going through these past 2 years. I've had severe constant headaches non-stop for the past 2 years with very loud tinnitus. I experienced joint pain, nausea and vomiting. I developed scoliosis on my spine. I've had autonomic dysfunction, psychiatric problems including depression, anxiety, memory and cognition issues, severe fatigue, and I've even developed 2 kidney stones and gallstones. These are also just a few of the symptoms that I have experienced. The list is exhaustive, and I wouldn't be able to fit them on the slide. Lyme disease is very serious, and it is a very complex disease. Thank you for watching our presentation on Lyme disease. We hope you learned something new from this.